Okay, welcome everyone. Welcome to our webinar today, supporting mental health and wellbeing in the workplace during the coronavirus pandemic. So before we begin, I'd like to acknowledge the traditional owners of the land we're meeting on today. I pay my respect to their elders past, present, and all Aboriginal people joining us today. First and foremost, we would like to thank you for taking the time out of your busy and topsy-turvy schedule to join us today. Whether you're in the midst of homeschooling, a busy work day, or an important baking session in the kitchen, we're happy to have you join us. My name's Laura Paulson, and I'm the Workplace Strategy Coordinator for the Achievement Program. The Healthy Workplaces Achievement Program is supported by the Victorian Government and delivered by Cancer Council Victoria. We support workplaces to create healthy environments and contribute to the improved health and wellbeing of their employees. We also have an education arm that supports schools and early years. Many of you may be interested in our new online wellbeing library to support health and wellbeing during the coronavirus pandemic. As well as resources, we'll be sharing case studies and stories about what workplaces and schools are doing to maintain health and wellbeing during this time. If you're in Victoria, we encourage you to check out our broader program, and if you're joining us from another state today, we suggest you check out the state government's workplace health program. Many Australians may already be facing increased levels of stress and anxiety, and it's important to consider how we can support the mental health and wellbeing of employees and colleagues during this time of change and uncertainty. We have pulled together an expert panel in workplace mental health and wellbeing today. We have Catherine Doherty from Beyond Blue, we have Catherine Newton from Are You OK? And we have Kathy Bond from Mental Health First Aid. Our session will be divided into 3 parts. First, we will discuss mental health in the workplace, so how to support mental health in the workplace during the coronavirus pandemic. We'll then discuss the warning signs that colleagues or friends may be showing if they're struggling or in distress, and how to start a conversation with them about mental health and wellbeing. We'll then end with, so you've asked, are you okay? What do we do next? A little bit of housekeeping before we begin. So as many of you have already figured out, we are a very large session today. We had over 1,000 registrations. We will be using the chat functionality for questions, and Veronica, our Healthy Workplaces Program Officer, will be manning the chat room today. You can use the chat functionality to ask questions during the webinar whenever you'd like, and we'll be pausing for questions after each speaker and then coming together at the end, hopefully time permitting, for one final discussion. To kick off, I would like to introduce Catherine Doherty. Catherine is the Workplace Engagement Manager at Beyond Blue, and Beyond Blue is a national not-for-profit organisation that provides information and support to help everyone in Australia achieve their best possible mental health. Drawing on her extensive experience in health, safety and wellbeing across a diverse range of work environments, Catherine strives to influence and develop capability in workplace leaders to support them to create and maintain mentally healthy workplaces. Thank you for joining us today, Catherine.
Hi Laura, how are you going? And thank you very much for the invitation and the opportunity to be part of the webinar today. It's really great to be joining you and the panel that you've brought together. I'd just like to also acknowledge the traditional custodians and the land that I'm on today, which is the Wurundjeri people of the Kulin Nations, and pay my respects to elders past, present and emerging. I'd also like to acknowledge everyone's lived experience with mental health, whether that be disclosed or undisclosed. We will all have, to some extent, our own experience, especially in the last 4 to 6 weeks. And I just want to acknowledge that all of us, whatever it is that we might be feeling today. Coronavirus is causing an unprecedented and rapidly rising burden on many people in Australia, with quarantine and isolation, job, business, financial stress, and the real anxiety of the uncertain and unpredictable times. They're all having a very negative impact on mental health and wellbeing. People in Australia are having to change the way that we live and the way that we work, and this is bringing a whole range of emotions. So it's time of unprecedented uncertainty, and it's perfectly normal to feel concerned and worried at this time, but also very important to understand that support is available. Like, you don't have to struggle on your own, and I'll outline Beyond Blue's support options shortly. So just staying on this slide now, thanks Veronica. I'll just give everyone a little bit of an outline about Beyond Blue before I go into too much of the detail. I just want to remind the audience of what Beyond Blue does. So we're a well-recognised brand, highly respected organisation, but not everyone knows what we do. So Beyond Blue provides information and support to help everyone in Australia achieve their best possible mental health, whatever their age, wherever they live. And I work in the Beyond Blue Workplace program. So Beyond Blue has had a workplace program since 2004, and in 2016, Beyond Blue joined the Mental Health Commission, research institutes, business and industry representative bodies to form the Mentally Healthy Workplace Alliance. And through that alliance, we promote workplace mental health. So coronavirus and COVID-19 has been in the news and on our radar since sometime before Christmas. But it's really been since about the middle of March that we've all been responding to this coronavirus crisis in Australia. So what that response has looked like has been different for everyone, depending on the level of preparedness of the organisation, the level of support organisations and colleagues are equipped to give, and our own adaptability and resilience at this time. But one thing is certain is that we'll all experience this crisis quite differently, and our emotional responses have been different and will continue to be different. And for each of us, that response can change day by day or multiple times throughout the day. And I think we need to just get to be comfortable with that and be okay with that. It's important to acknowledge that we're going through a period of rapid change, and that brings uncertainty and confusion. And we've identified 4 main categories of workplace impacts that we're seeing at this point. So hopefully these reflect the workplaces that you represent and the challenges that you're facing. So those 4 are working from home, essential workers, workers who have been stood down, and those experiencing job loss. So I just want to go through those one by one. So many organisations, and certainly those that can, have made the move to having their people work from home. So individuals, whether it suits their living arrangements, their household structure, or their personality, are now trying to work remotely under a whole new set of circumstances. And it's important to acknowledge that working from home, for many of us now, will feel very different to working some days from home, alone and in peace and quiet, interspersed with days in the office amongst colleagues and with other friends. And for others, it will be a whole new way of working and living. And that will take some time to adjust to. So working from home is also requiring us to adapt to using new technologies and new ways of working. And this webinar is a perfect example that we're having to pivot to do things more online than we would have done previously in face-to-face and in person. So managing remote teams is more familiar and more comfortable for some leaders as well, and others will be struggling with this aspect of having people working remotely. So some will be more capable and experienced, and we need to draw on the experience and support from those leaders to support the others who might be more nervous about it in your workplaces. And pivoting to outcomes-based work rather than output and time spent has been another change for some. So in that small snippet of just the people working from home, there's a whole lot of change and readjustment happening, and a whole lot of feelings and emotions that are going alongside that. The other group are the essential workers. So not all organisations have been able to make the shift from home, and not all of them can. And so it's important to acknowledge that many essential workers are still required to attend for work. And that's so that we can continue to access healthcare, pharmaceuticals, buy essential items. So supporting these people are all of those other people working in the public transport system and in transport and logistics to ensure that those goods get to where they need to be when we need them. And amongst this group, I think an acknowledgement to the dedicated Centrelink staff whose workload and job demands have just increased exponentially. So many of these sectors are also facing unprecedented demand and have to rapidly mobilise to increase their workforce. So some would have found this easier than others, but it would have been a challenging change piece nonetheless. We also have to remember that family members and the housemates of essential workers and the challenges that they are presented with to stay safe at this time. And the third group are those who've had the difficult decision to stand down staff. So these are not easy decisions to make, and they're not easy conversations to have, and it can have an impact on the individual that's delivering the message, which is usually a manager or a small business owner. And we know that small business owners have an additional mental health pressures during normal business operations, and at these times have been much more challenging for them as well. And the fourth group to acknowledge is those who have unfortunately lost their job, whether they be permanent or casual employees, but it also extends to independent contractors and small business owners who have actually lost their business. So losing a job at any time can be a really stressful experience, but in the current circumstances, job losses seem to be much more widespread, and there's increased uncertainty about gaining future employment, with the added challenge of now navigating the financial support systems that thankfully the government have put in place for people. If you've needed to stand down staff, we really encourage you to keep in touch with them and help them stay connected back into your workplace and stay connected with the people that they used to work with. The coronavirus is causing an unprecedented and rapidly rising burden for many people in Australia, with quarantine and isolation, job, business and financial stress. The real anxiety of such uncertainty and unpredictable times are having negative impacts on mental health and wellbeing. And Beyond Blue has seen a 20% increase in demand for our support services in that time, and that increase is evident across the mental health sector. And currently we're only about a month into the crisis that potentially could last 6 or more months. So people in Australia are having to change the way that they live and they work, and this is bringing uncertainty in a range of emotions. It's perfectly normal to feel concerned and worried, and it's important to understand that support is available. You don't have to struggle on your own. I'll outline Beyond Blue's support service options shortly, and Kathy and Catherine will talk to you about how we can support each other, which will be really valuable. But what does this mean for workplace mental health initiatives, the strategies and the programs that you might have been thinking about putting together or that you might have already had in place before this crisis started? Well, they are needed now more than ever before. So Beyond Blue has always advocated for healthy workplaces to protect mental health, where we foster a workplace culture that's positive, we manage stress, support people, and take a zero tolerance approach to discrimination. And these are all still really relevant now. It's just that the way that you deliver them and support staff has changed. So it's important to keep these structures and these programs in place and then change the way that you're delivering them, because they really will keep your employees connected and safe and help them manage the stress that they're going through now. So we've always said that there are 3 critical success factors to a successful workplace mental health program. And these, again, are even more relevant today. So we need senior leadership commitment, and that needs to be sustained throughout this crisis and beyond. Whatever the other side looks like, it's not going to be the same as what we've had before. Connection and collaboration and engagement with employees is even more critical now. We need to make deliberate, purposeful, regular communications at this time. We need to reach out to other people, and we need to see and hear from leaders in our organisations, helping us work through this process, helping us to normalise some of those feelings of uncertainty that we're all experiencing, and helping to share and point us and show us that there's some direction coming. And I think this statement seems even more relevant in the current circumstances, that the role of a leader in creating a mentally healthy workplace is to promote awareness, and importantly to promote a culture that allows people to take steps that they need to stay mentally healthy. So the best practice in workplace mental health, we would always say, is to develop an overarching strategy that covers all 3 areas of an integrated approach. And this integrated approach actually works still. And it's really relevant now because it will provide you with a clear structure and a framework, a place of certainty perhaps, on which you can identify and implement some relevant actions. And the actions may need to be changed and tailored to better suit the current environment, but you can still use this structure to give you some direction and some clarity. So Beyond Blue believes that mentally healthy workplaces prevent harm to their employees, that they promote the positive aspects of work and protect the wellbeing of their staff and support staff with a mental health condition. So if you take this integrated approach, you look towards preventing harm, promoting positive aspects, and providing support for staff, whatever the cause of their mental health concern. So if we just look at the mental health risks and the protective factors to start with, I'm not going to go through this slide in too much detail because it's very complicated, but if you've seen it and you've been familiar with it before, you will see that I've added into the individual and the role issues of isolation, concerns about working from home. And in that, we need to add in social connection as the critical response. Likewise, the environmental aspects are really prevalent now, given that people are working in very different arrangements. And then keeping in mind the occupational risks, because we have added exposure and transmission potential for some particular work groups. And anyone who needs to quarantine, we need to think about how do we support them in that quarantine time. So promoting the positive, we'd encourage everyone to establish a routine. It seems much more important now, particularly with people working from home. It's time to get out of the pajamas and start having some structure in every day. Work out ways that work for you to manage that uncertainty. Stay connected, take care of your physical health, because that helps to nourish your mental health, and practice self-care and mindfulness if that works for you. And I'm very excited to share with you that Beyond Blue launched just last week a dedicated coronavirus mental wellbeing support service as a new way to offer support for yourselves, your families, and colleagues in terms of managing through this particular time. The coronavirus mental wellbeing support service is available nationally, and it's free. It was funded by the Australian Government and delivered by Beyond Blue. It's available around the clock, delivering clear, evidence-based information, advice and support specifically tailored to the mental health and wellbeing challenges raised by this pandemic. Through a digital site, the service offers easy access to a broad range of supports, from online wellbeing tips and self-help tools to phone counselling from trained mental health professionals and peer-to-peer support through online forums. We want to help people stay well and to help people to cope at this time. It's important to stop things getting worse for people who are really struggling. And so the next few slides will just give you a little insight into what the site looks like, and then I'll encourage you to look at this after this session. So looking at the impacts of work in particular, information here is relevant for educators, essential services, working from home and business owners. And the content on this site will continue to be developed over the next 6 months. And again, information for different groups of people that we can tap into, small bite-sized pieces that we can tap into as our needs emerge and different things come up for us. Lots of information about coping with isolation and being at home at this time, and lots of tips on how to stay connected. And for small business owners, their mental health at this time is really important to preserve and protect, and lots of good resources for them. So the website is a separate microsite to the Beyond Blue site, but it is accessible through beyondblue.org.au site and the headsup.org.au sites, but it is coronavirus.beyondblue.org.au. I'd encourage you to take a look at the new site, share it with your networks and promote it to your staff and colleagues. Thanks, Laura.
Fantastic. Thank you, Catherine. That was wonderful. We've just had some questions coming through. The first question is, what advice would you give employees who are finding blurring work and home boundaries and are struggling to set boundaries for themselves?
Yeah, that's tricky. I must say I've struggled with that at times as well, but I think it's really important to allocate different spaces for work and different spaces for family time, if that's even possible. But perhaps have little cues about when it's work time and when it's not work time. And thinking about, you know, because we're working from home, it doesn't mean that we have to work all day and all night. So we have to be really disciplined, probably more so than before. And perhaps that means actually leaving the house in the morning to take a walk around the block before you start, and then going for a walk in the afternoon and coming home like you would come home from work. Taking time out for regular breaks, taking those breaks away. It's okay to take those breaks outside, and it's really important to be physically active when you take those breaks.
Great, thank you. And we've got one more question. Can you elaborate on managing uncertainty? So can you provide any more examples of strategies to promote a positive environment?
Sure. Look, there will be lots of information on our website. I'd encourage you to go there because the way to manage it will be different for different groups and different people. And that might sound like a bit of a cop-out answer, but there isn't any particular solution, a magic solution that would be the same for everyone that would work. So there's lots of ideas and lots of tips. Some of those will resonate with some people more than others.
Fantastic. Thank you, Catherine. I know we've got a lot of questions coming through, but in the interest of time, we're going to move along and come back to some more after the discussion. But thank you so much for joining us. Next up, we have Catherine Newton, who is the CEO of Are You OK? Are You OK is an organisation most well known for Are You OK Day, a national day of action committed to encouraging and equipping everyone to regularly and meaningfully ask, "Are you OK?" of anyone who might be struggling. Since the inaugural Are You OK Day in 2009, Are You OK has become a household name, and in 2019, an estimated 87% of Australians were aware of Are You OK, with 1 in 4 taking part in some form of Are You OK activity throughout the year. Welcome, Catherine.
Thank you so much for having me, and thank you, Catherine, for that brilliant information. Hello, everyone. Thank you for having me here today. Really conscious that you're a group who would certainly have a lot of skills behind you in your respective fields. You've most likely got some qualifications. You're very much an expert in your role. But what I'm here to talk to you about today is absolutely with a workplace lens, but wanting to let you all know that you don't have to be an expert to start a conversation with someone you're worried about. And what we'll go through today is about how other things that are happening in your life might be brought to work and how we can spot the signs that someone might be struggling. Sometimes these things seem very obvious to some people, and for others, it's a real eye-opener. What I would preface to say is that at Are You OK, we keep things really simple. We don't want there to be any more barriers to a conversation. And so having that simple question, those 4 letters of Are You OK, can make such a huge difference, and it can indeed change a life, or in many circumstances, it can save a life. Are You OK is, in essence, a suicide prevention charity. Our founder was Gavin Larkin, who sadly passed away 2 years after Are You OK started. He founded it in 2009 after his father took his own life, and he wanted to stop other families experiencing the same. And thus Are You OK Day was born. And now, a decade later, we're still honouring Gavin's memory and his mission, which is to inspire and empower anyone to have a regular, meaningful conversation with someone who might be struggling with life, in the hope that we can stop small things becoming big things. And if there is a need for that intervention, that we can get some help for people and get them to access the help that they need. So, why are we here? Why does Are You OK exist? Well, it's because we all need conversations, because we're human and we all go through life's ups and downs. We're all very keen to talk about how well we're doing, how well our families are doing, and what the holidays are and how everything's going. We absolutely know the conversations that happen on social media. And what we're trying to do is, as Catherine mentioned, it's about normalising these types of conversation when someone isn't okay. Quite often, it might be obvious that someone's not okay, such as going through a time like this, but sometimes the signs are really subtle. Sometimes people don't feel like they're leaders or managers. Sometimes they don't feel that they can be open and transparent with their colleagues. And I noticed there was a question there about what about if your managers and leaders don't, really believe or get on board with the mental health message. And I think it's about that grassroots movement. Why Are You OK has been so successful is it's driving that message from the bottom up, that this is important, that we can't be expected to be okay all the time. There cannot be ups, there always has to be downs. And when we bring ourselves to work, we bring with us a human being, and we bring with us things that are happening at home. And so to try and to create that drive to manage up, to get some colleagues together, to get a team together, to speak to an HR manager or a wellbeing champion, to speak to that leader to say, this is important, head to Beyond Blue, the heads up resources specifically for workplaces, or indeed the coronavirus resource that Beyond Blue have just launched, to say that this is why it's important. There is evidence to show this affects us all. Some of the really, I would say, some of the most common downs are relationship breakdowns or troubles. Sadly, we all grieve. We're going to lose people in our lives, unfortunately. Work pressure or a lack of work, and that was, even before the virus started, we all faced that. And financial difficulty. So there's some of the really common downs that people have. And it's at these times, it's the support of friends, family and loved ones that can make a difference. And that's where Are You OK is different. We don't speak to the person who's struggling. We don't speak to the person in need. We speak to the people around that person. We're trying to create that, sometimes we call it a social scaffolding or a community safety net, as a social safety net, so that we can say to people, I care about you. I've noticed this is happening. How can I help you? So that's where we're a bit different, and we can all make that difference to the people in our lives. So when we think about what else might be happening alongside those common examples I just shared, let's have a think. So right now, parents are struggling, tough time with kids, homeschooling, that's inevitable. Environmental stresses, really important. We don't remember all of those people who just went through the most horrendous bushfire season, along with flooding and drought. These things don't stop, and there is such a community effort to rebuild. It's important we don't forget that. And of course, that those environmental factors can be so long-term that they can really impact on people's well-being, mental health. People, indeed, may be diagnosed with a physical illness or disease, may be suffering from chronic pain. If we think about other things, perhaps there's addiction, people self-medicating with alcohol and other drugs. There's loneliness and isolation, which is what many are experiencing right now. Of course, there can also be mental illness, whether that be an illness like depression or anxiety, or a more complex illness, an enduring illness such as bipolar or schizophrenia. It could be retirement. Retirement is a stage of life that will come to us, to many of us, and that's a very different stage in life, as is becoming a new parent. I'm sure there are many parents on the webinar today. It's huge. It completely turns your world upside down, and so that might be a time where it's difficult. Study pressures for students, whether that be at school or at university, and of course general stress in life. So there's many things that might be happening behind the scenes. So how do I know someone might be experiencing, might need some support? So if we think about, if you know them well, family or friend member, then you might know that some of those things we've spoken about are happening. But if it's for work, it might be that you've just overheard, or you're just getting a sense that something's changed at home or in the workplace. Perhaps there's job losses, there's change management happening, there's a change of leadership, there's a change in dynamics in the team. So anything that really gets our radar up for something happening in their world. Are they under a bit more pressure at work? Are they changing their physical appearance? And we know that there is so much, the Are You OK message is really about stay connected at the moment. So trying to still see people face to face over devices can really give you a clue as to how they're traveling. For example, if they don't switch on their video, yet everybody else is, that might be a clue that something's happening. It might be that they've got children hanging off of them and they're still in their pajamas, of course, but it could also be a sign that they're not, something's happening. Perhaps they're looking disheveled. Perhaps you can tell that they're not sleeping. Maybe they're getting bigger or smaller. So its physical appearance can be really helpful. Changes in mood. Are they being more withdrawn? Is their mood lowered? But also look out for, could it be the other way? Are they more manic? Are they more exuding pressure? Are they overemphasizing things? Things where you think, that's just not them. That's just out of the norm. That's not their normal behavior. That's not how I would usually engage. So that's something to look out for. Changes in how thoughts are expressed. If we think about what they might be saying, a really big cue that someone's struggling is that they're saying that they feel like they're a burden to others. They're a burden to their family. They're a burden to their workplace. And that's something we really want to look out for. We want people to know that they're not a burden, that we are better off with them, and that we want them to be in our worlds. So really look out for that one. Perhaps they're talking about a sense of hopelessness, like, there's no point to it all anyway. There's no point. There's no value to what I'm doing. I feel worthless. I'm not giving anything. Maybe they're failing to see a future, and that could be difficult at the moment with the direction. They might be saying that they feel alone, which is quite likely right now. Or indeed, they might be talking about dying and about death. And this is where these are the really important cues, as I said, to listen out for. There are also some things that they might be doing. Some other things, apart from the ones that I've mentioned, maybe you're seeing a change in social media. At the moment, there's so much on. Maybe they're posting more or less. Maybe it's a birthday and they always respond to happy birthday messages, but they're just not at the moment. Maybe the images they're posting, maybe the language they're using is a different tone. So social media, while it does have its challenges, it can be a really good way to spot changes in someone's mood and behaviour. Reckless behaviour, increased alcohol and drug use, giving away possessions, talking about insomnia, social withdrawal, and those changes and fluctuations in appearance. So I'm just trying to give you some signs here that you could be spotting that someone needs that support. So I hope that they've been helpful. I'm sure there are more, but these are the key ones that we let people know to keep on their radar. So the most common question we get asked is, so what do you do if they say no? Asking, are you okay, can indeed take courage. It can be awkward. You might be worried. You might be afraid of the reaction. Indeed, what am I going to do if they say no? I'm not equipped for this. But what you do know is that you're asking in a meaningful way because you care. And that's the most important, that you're being genuine and meaningful with this. And you're asking them as another human being. It's about a two-way conversation. So what we'll go through now is some steps on how to have the conversation if someone says no. And the reason why I've got this picture here is introducing the acronym of ALEC. So the steps all stand for the first letter of each step is an acronym for the name ALEC. So let's keep that in mind as we go through. Really important, as someone's just mentioned there, to ask leaders, HR managers and wellbeing champions who might also be struggling, important to ask if they're okay. And that's incredibly true. And I always say to people that it's really important that you're okay first and that you're ready to have this conversation. Are you in a good health space? Are you feeling safe and supported? Are you feeling well? And are you ready to listen? Because the worst thing, I'm sure you've all experienced it at some point, is when we want to talk, someone's asked us a question and then they just walk by. It's a, hey, how you going? And they're not really stopping to listen to the answer. So do you have enough time to give this person? Being prepared. It's very likely you're not going to have all the answers, and that's okay. You don't have to have them all. It's likely that you might feel a bit confronted about what they need or what they want. And you don't have to know all of the answers to the whole mental health sector. You don't have to have medical or clinical or psychologist behind you. It's about knowing that I might not have the answers, but I can help them find the answers. And listening to struggles can be difficult. They might get emotional. They might get embarrassed or upset, but try to prepare as best you can. For example, if you know someone might get a bit teary, then have some tissues handy. If you know that this is in a workplace capacity, it might be worth just letting the HR manager know, or another colleague or another manager know that you're a bit worried and you're going to have this chat. Because it's absolutely fine to bring in other people to this. You don't have to carry this on your own. If you're really worried about someone, bring in someone else that they trust and you can work through this together. And sometimes, of course, people aren't going to be ready to talk. I'm sure we've all heard it. People say, I'm fine, there's nothing wrong. So it's important to acknowledge that this is about them. It's not about you. And that if they say they're fine, then you can say, okay, well, this is what I've noticed, and this is why I wanted to have a good chat with you, but I understand you don't want to talk right now. Maybe we can catch up next week, or maybe there's someone else you feel comfortable speaking to. Picking your moment. So I'd really suggest we pick somewhere relatively private and informal. For example, not in the staff room when there's heaps of people around, probably not at the water cooler, definitely not in the lift. Somewhere where that other person is going to feel safe and comfortable and not confronted. It's got to be about them. Maybe ask them, when's a good time for a chat? Some people ask me, well, how long should I give? And that's a really difficult question to answer, because how long's a piece of string? But if you're a busy person, at least give yourself an hour in your diary to be able to really give them that time. And if they can't talk, as I said, ask them for a better time to speak. So here is where we get into the 4 steps. So the number 1 of our ALEC acronym is to ask, are you okay? Try to be relaxed. Help them open up by asking open-ended questions. You don't have to say, are you okay? It could be, how are you traveling? How are you going? It's a tricky time at the moment. What's been happening for you? Or I noticed you haven't been yourself lately. I've noticed that you've not been coming along to meetings. I've noticed that you're a bit withdrawn. I know that you're going through a relationship breakdown. Just wanted to check in and see how things are going. And when you make that observation, it's better to be able to tell them what you've noticed and almost give them the evidence or the fact, because if they do say I'm fine, because they still feel as though they need their mask on, they still have their mask on because they're not quite ready to speak about it yet or to find that help, that they can, that you're saying, well, this is what I've noticed. And maybe then that might help them think, oh, she has noticed, he or she does genuinely care. Next time they ask, I might consider honestly answering, no, I'm not okay. Step number 2 is to listen. So very often when you have a conversation like this, it's about you being quiet and it's about you listening. It's about taking what they say seriously and not trying to interrupt or rush the conversation. Sometimes it can be really hard if you're a person that loves to chat and you want to interrupt and jump in. Let them speak, let them get what's off their chest out. You know, we all feel so much better when we've actually verbalized what we're thinking and feeling, when all these things are racing around in our head. Encourage them to let you know how it feels for them and what's going on, and try and be patient with silence. Sometimes if you can be silent, it helps them take a moment to think about all the things that are in their head, and it can help draw them into the one thing that's really worrying them. If they're very what we call scrambled egg brain, you can say, what's the one thing that's troubling you most right now? Is there one thing that you can pick, and perhaps let's tackle that, or let me see if I can help you with that first. And if they do get angry or upset, or they still say they don't want to talk, don't take it personally. Remember, this is about them and when they're ready. The next step is encouraging action. And this is where people get a little bit worried because they think, oh, what do? I don't know how to help fix that. But you can ask, what do you think you need right now? What would help you manage the load? What do you think is the next step from here? How can I help you? Sometimes people just need to talk. They just need you to listen. And that's all that's needed right now. Sometimes you can encourage them to book an appointment with the doctor to say, look, I think it might be a good idea if you have a chat to someone. Perhaps they already have a psychologist or a counsellor, encourage them to see them. Perhaps you can encourage them to speak to their manager. If they're not comfortable and don't trust their manager, perhaps an HR manager or a champion or another wellbeing, or perhaps even someone in the team so that you can tackle it together. Also EAPs, employment assistance programs, are great. We've got all that free confidential counselling. And also sometimes I'll say to people, I know you don't want to worry me when you're lying awake at 3 a.m. at night. Call Lifeline, call Beyond Blue. There's services there that you can talk to who are non-judgmental, and you don't have to worry about waking me up. Sometimes people just need to know that someone's there. And finally, number 4 is to check in. So if someone's opened up to you and you've had this conversation, you've built that trust, you've built that relationship. And that's where you can check in the next couple of days. How are you going? How did you get on with that thing we've spoke about? I'm still here with you for the long haul and I want to support you. There are 4 steps. There are many ways that you can reach out for professional support. Please do head to Beyond Blue's website, to Lifeline, and we've naturally got Mental Health First Aid who can tell us how to take it that step further.
Thank you so much, Catherine. Again, another fantastic presentation. We've got time for one quick question before we move on to our next panelist. Let me just have a look what we have. We've got a question: how do you support an individual by setting up scaffolding around them and not being seen to be prying into their business? So I think this is in regards to having conversations with people you might not be so close with.
Yeah, I think it's, confidentiality is really important. And the thing this comes down to is trust. If you think that that person is going to think that you're prying, then I would suggest that you talk to somebody else. Perhaps it's another family member or another colleague, without breaching that confidentiality, but say, look, I'm worried about them. I don't think I'm the right person. I think they're going to think that I'm prying. What do you think? So bounce it off of someone else. And if you are going to approach them, I think it's absolutely fine to say, look, it might not be something that you want to share with me, but I'm just letting you know that I'm concerned. Perhaps there might be someone else that you want to speak to. So I very much appreciate that trying to gain that trust can be difficult, but just to try to work around it and let them know that you're asking because you care.
Great. Thank you so much, Catherine. We'll move along, but we'll come back to everybody hopefully at the end, time permitting. Next up, we have Dr. Kathy Bond from Mental Health First Aid. She's the newly appointed Workplace Engagement Manager at Mental Health First Aid. Kathy has been with Mental Health First Aid Australia for over 7 years as a researcher and is passionate about the impact mental health first aid training has on mental health in the workplace. Mental Health First Aid is an evidence-based training course which gives your employees the skills and confidence to help have supportive conversations with their co-workers and help guide them to professional help if needed. It has been shown to increase knowledge, confidence, and helping behaviours and to reduce stigma. Thanks so much, Kathy.
Great, thank you. I want to start by acknowledging the Aboriginal and Torres Strait Islander people as the traditional custodians of Australia and pay my respect to elders past, present, and future. I'd also like to acknowledge people with a lived experience of mental illness and their contribution to the work of Mental Health First Aid. So today I'm going to quickly tell you what Mental Health First Aid is, give you a few quick and dirty tips that you can use to help support your colleagues, and then share with you some of our resources that will hopefully be helpful to you. So I just want to note that whilst you've gotten a lot of good tips today throughout, and I'm going to share some more with you, there's certainly a wealth of other information and tips and training that you can do that will help you be able to support your colleagues. So I would highly encourage you to look into doing some more training as well. But Mental Health First Aid is the help provided to a person developing a mental health problem, experiencing a worsening of an existing mental health problem, or in a mental health crisis. The first aid is given until appropriate professional treatment is received or until the crisis resolves. It's not therapy, and it doesn't teach participants how to diagnose. So our courses are based on the best possible evidence, but where this evidence isn't available, we gather expert consensus using the Delphi research method. And from those studies, we develop the guidelines that you see here on this page. And then we use those guidelines to form the basis of our courses. So we have an action plan similar to physical first aid and Doctors ABCD. Ours is called ALGE. It's approach the person, assess and assist with any crises, listen and communicate non-judgmentally, give support and information, encourage the person to get appropriate professional help, and then encourage other supports. And Algie is a koala, and he's our mascot that you can see down there in the corner. So as someone who is either a mental health first aider or as a friend or colleague who's supporting someone, your role is to notice and ask, listen to what they have to say, and point people to information and professional help. You're not there to diagnose, and certainly you're not there to solve the person's problems. You might feel like you could, but even if you could, it is not probably the most helpful thing for the person. So first and foremost, I think probably one of the best things you can do is listen to the person and show empathy. So you can do this in a number of ways. You can do this by asking questions that demonstrate you care and want to help. You might ask questions that clarify what the person has said so that you're showing that you're interested. You can also ask, a really great question to ask is, how can I help you, or what do you need from me? As has already been highlighted, listening is really important. Listening and noticing what's going on in their tone of voice and body language is also important. It might give you some clues that they are not traveling so well. It's important that you allow someone, particularly if they're experiencing some symptoms of depression, plenty of time to talk. Their thinking process might be slowed a little bit, and they might just need that extra space to allow them to be able to communicate well. And as has been said before, don't be afraid of silence, because sometimes that's exactly what the person needs. I'm going to talk a little bit more about providing a private space for conversations. And it's also important that you reassure them that it's okay that they're feeling the way that they are, and that it's probably quite reasonable. So it's certainly different at the moment supporting a colleague or a friend with mental health problems right now with social distancing. But here are a few things that might make it a little bit less daunting. First of all, if you're going to sit down and have a conversation with someone, I'd pretty early on be talking about a plan for what happens if the technology fails. So straight up front saying, look, if things drop out, if the video stops working, if you can't hear me, I'll call you on the mobile, or if they've got a landline, I'll call you on the landline. But some prearranged way to manage any failing technology. If you're on the phone, tone of voice is particularly important because they can't see your facial expressions. And also you may need to use more cues to let them know that you're listening. So if you're doing a good job letting them talk a lot, you still may want to do things like, say and because they can't see you nodding your head, and they can't see that you're looking at them and that you're engaging with them through eye contact. Privacy may be more difficult at the moment because you may be working at home with a partner, your kids might be around, same might be happening for them. So certainly early in the conversation, negotiating, finding out if they're alone, if they can go to a quiet, private spot. If not, it might be a good idea to maybe take a walk around the block, be on the phone at the same time, just to allow for a little bit more privacy. And one thing that I'm doing right now that maybe others might find helpful is being a bit more intentional in my contact with coworkers. So I can no longer kind of catch up with people and hear how they're going over the kettle or at lunchtime. So I am actually trying to book in at least once a week to have morning tea or afternoon tea, spend 10 or 15 minutes with them. And we might talk about work, but we also might catch up on the latest Netflix series that we're watching or find out, how they're going. So that is one way. The other way as a manager is to be sure to be meeting with your staff regularly. So my team, we meet every day, whether we feel like we need it or not. And it's just, sometimes it might be a 3-minute conversation to go, how are you going? Is everything okay? And other times it might take a bit longer. There are some things that you shouldn't do. There are things that I think sometimes we think would be helpful, helping the person to be more positive, to feel better about themselves, but often they can not be helpful. So avoid saying or doing things that could be perceived as trivializing. So saying to someone, oh, you look all right, you're looking great. Oh my gosh, you have so much to be thankful for. That can really minimize the feelings that they're having and the things that they're experiencing. Usually it can be comforting to know other people have gone through what they're going through, but I think you want to use that sparingly because if you say to them, I know what you're going through, I've had the exact same experience, they might think, well, if you know what I'm going through, I don't need to talk to you. I don't need to open up. You've got all the information. Telling the person to stay busy, get out more, snap out of it, get your act together. Come on, man, people are noticing that things aren't great for you. All of that can be patronizing, can feel like you're accusing them. It might embarrass them. So being really careful about what you say. And also important not to minimize the person's problems by comparing them to your own problems or other people's problems. So what if the person is suicidal? What if you get a feeling or they've said something? I think it's really important to ask about that. If you have a sense that you think the person might be suicidal, to ask directly about it. It's important not to say things like, oh, you're not thinking about doing something silly, but being really direct. Are you thinking about suicide? Are you thinking about killing yourself? Are you having thoughts of suicide? I promise you, you cannot put the idea of suicide into someone's head. And it's just really important. They are likely to feel quite relieved that someone's willing to talk to them. Take any threats or warnings seriously, particularly if the person believes they're being persecuted. The conversation that you have with someone about being suicidal cannot be kept confidential, and you need to talk to them about that and seek assistance from someone else, whether that be a supervisor, mental health team, EAP, but negotiate with them. You can talk to them. You can say, I can't keep this confidential, but who can we talk to? Who would you like for me to talk to? And then finally, just take any necessary protective actions. So that might be calling on the police to do a welfare check or contacting the mental health crisis team. So professional health care is important, but we know that 65% of people with a common mental illness do not seek professional help. But we also know that people are more likely to seek help if someone suggests it. So always suggest it. If it, you don't need to force it on them, but suggesting that they might find talking to their GP or a psychologist helpful is always a good thing. Okay, so now I'm just going to go into sharing some of our resources that we have. So I told you our courses are based on these guidelines that we've developed. If you go to our guidelines page on our website, you will see all of them. There are a number of them, from how to support someone with a specific mental health problem to supporting someone from a specific cultural background. If you go about 3/4 of the way down the page, you'll hit the workplace section, and we've got 3 sets of guidelines. One is on providing mental health first aid to a coworker or an employee that you manage. And then 2 are guidelines that the University of Melbourne developed on helping someone successfully return to work after mental illness and workplace prevention of mental health problems. We've also developed a COVID-19 page that points you to all sorts of resources, both external and internal. 2 of the things on there that might be helpful are resources we've developed on assisting someone affected by the COVID-19 crisis and dealing with COVID-19 anxiety. And then, of course, we have our courses. We have our standard mental health first aid course, which is for adults assisting other adults. And we have our mental health first aid course that's been tailored for the workplace, and that's offered in a blended format. And in fact, in the next few days, a new course will be launched, and that will be a fully online course. It will involve doing some e-learning and then meeting face-to-face, but via video conferencing. So please keep a lookout for that. The first one to drop will be our community course, and then shortly after that, we'll launch our workplace course, and then other courses after that. And finally, the workplace engagement team. So we're here, myself and my teammate Mary, who's somewhere in the audience here, are here to help you embed mental health first aid into your mental health strategy, to help you figure out the best way to train your staff. And we also have a skilled workplace program, which is a recognition program for workplaces that are embedding MHFA into their mental health strategy. So if you have questions about that, please do contact us, and we can help you. Okay? Thank you. I think, yep, that's my last slide. Thank you.
Fantastic. Thank you so much, Kathy. I understand we've run over. We're going to bring everyone back for one last question, but before we do, a question just came through for you, Kathy. What's the difference between the community and workplace mental health first aid courses?
So they're very similar. Where they differ is that there'll be information in the workplace course that is specific to providing mental health first aid to a colleague, or if you're a manager, how to provide mental health first aid to your staff. And the scenarios and the films in the course are different, yeah, but the basic information is the same.
Great, fantastic. We've got everyone back now, so we've got our Catherine, and Kathy on board. So for the final time, we would like to say thank you so much for being a part of our webinar today. The comments that have been coming through have been very grateful. They said the information is very useful right now. To finish off, we would just like to ask, what is a tip from each of you? What's a tip you can leave us, or a call to action you can leave the audience with today about how we can look after either our own or our employees or our colleagues' mental health during this time? We'll start with you, Kathy Bond, as you've got your microphone off mute.
Sure. So I've already shared this, but I think the best thing that you can do to support your colleagues is to check in regularly with them, whether that be a quick text or a quick phone call or actually booking time to spend with them, but to do that regularly with your colleagues.
Fantastic. How about you, Catherine Doherty?
That's it. Thank you. I think at this point it's about being kind to ourselves and acknowledging that it's not easy, it's difficult, these are really difficult times, and it's going to be a bit bumpy along the way. And so really think about what are some effective self-care practices that we can take, and then how can we reach out and stay connected with our colleagues and our friends in this virtual world and have that meaningful connection as well. And I think if we keep doing a bit of that, then we might get through this at the other end with some interesting stories to tell.
Thank you. And finally, to close out, Catherine Newton, what are your thoughts?
Thanks. I think for me, it's about acknowledging to ourselves and others that there's a lot of talk at the moment. So there's a lot of hours being spent of people needing to talk, and that's fine. But it's also about acknowledging to your team or to your managers or to your leaders what's working and what's not working. So I think it's really important that we're honest at this time. So asking your team what works for you and what might not work for them. So for example, I don't work well with instant messenger, keep on popping up. I find it really distracting. So I've let my team know that that's not good for me if they need me to SMS or call me. So I think it's about working out what's best for you, consider your platforms, and also consider your organizational communications or your team communications. There's so much information right now. We're all talking, we're all reading a lot. Just consider timings. Timings and platforms, I think, is really important to be open and transparent.
Wonderful. Thank you so much. There's a lot of thanks coming through. Now we're getting a lot of questions about sharing slides and recordings. Yes, we have recorded today. We're just going to be having a chat with our panelists and then seeing what we can pull together and what everybody is happy to share. Other than that, we will be looking at running some more webinars through the Achievement Program. And we appreciate that this was our inaugural webinar and we had such amazing panelists join us. So thank you again, ladies.
Thank you for having us.
Fantastic.
Thank you,
Be
Laura.
well,
Thanks for the
everyone.
opportunity. Thanks, ladies.